Thank you so much for joining us. This is Nora O'Brien from Connect Consulting Services. We're here today to talk about inclusive emergency management. And what that means is integrating the needs of people with access and functional needs into your disaster and emergency planning. Ever more important in time of the COVID-19 pandemic we're experiencing. But unfortunately, we're still going to continue to have COVID plus events such as hurricanes, wildfires, hope to God not earthquakes, etc., and severe weather events. So it's important to understand what your planning considerations in meeting the needs of people with access and functional needs. So today we want to let you know a little bit about how the GoToWebinar system works. So you can ask a question. We do hope that throughout the presentation you are able to ask a question. And the questions we get all the time in the beginning is, can I get the slides? So we're going to send them out after the webinar. Can I get the slides? Can we get? That's usually the first four questions that we get. How can we get the slides? When's the recording going to be available, etc. So we just thought we'd put that as a frequently asked questions because we get that all the time. So can I get the recording? That's also the second question that we get all the time. So we are going to be sending it out with the slides after the recording. We also have a Connect Consulting Services YouTube channel. You are feel free to subscribe to our YouTube channel. We're trying to get our numbers up. So and that's where also the materials will be recorded as well. You can see the recording and get the slides. So, but if we hope throughout the presentation, if you want to ask a question or if you have a comment, put that in. We're actually going to get to questions near the end. So if you hear one of the speakers, our wonderful Amanda and Lori, share something, or if you want to comment, just put that in the question box and that we will afterwards be able to access them. So we will get to your questions, and we do want to hear how we can better serve and get the information to you as best we can. So moving right on to our speakers today. So I want to briefly introduce you. We have our great planning specialists. We have Amanda and Lori. I'm going to have them talk a little bit about their background, but they're certainly well suited for our topic today of inclusive emergency management. Amanda.
Good morning, everyone, and thanks for joining us. My name is Amanda Cooper. I am a planning specialist here at Connect Consulting Services. Before coming to Connect Consulting Services, I was an advisor, senior advisor for FEMA, where I advised senior leadership on inclusive emergency management and making sure that the needs of people with disabilities and other access and functional needs were included in all phases of emergency management. I also hold a master's degree in public health. Before moving to FEMA, I was a public health emergency manager for the state of Alaska for about 10 years. I currently am an adjunct instructor on integrating access and functional needs into emergency planning for FEMA's Emergency Management Institute. I'm a certified ADA coordinator, certified ADA professional, and the bulk of my career has really been focused on public health and access and functional needs. Very happy to be here today.
Great, thank you very much. And Lori Benblatt. Lori, do you want to share a little bit about your background?
Sure. Hi, everyone. I'm also a planning specialist with Connect Consulting. I have been working in the disaster and emergency field as a readiness and recovery specialist for over 15 years, and I've worked mainly in the intersection of public and global health and behavior health needs. I've worked throughout the United States in multiple hurricanes in Maria, Irma, and Harvey. I've worked in Haiti and Zimbabwe, South Africa, and Brazil. And my background is as both a mental health specialist and public health specialist. And I landed in this field to make sure in the intersection of those two areas to make sure that people's needs are being taken care of. Thanks.
Thank you very much for joining us. Okay, we're going to give it off to Amanda. Oh, Oh,
Lori.
Lori's going to start.
Yes,
Sorry.
Lori's
about
going to
that.
start us out.
All right.
No problem. So today we have a pretty exciting agenda. We're going to start off with why are we even doing this? Why is being inclusive important? Looking at what the access and functional needs overview is, defining what does it mean to be accessible and address functional needs of all individuals. We're going to include a little bit of behavior and mental health within this topic, both as they interrelate with each other, but also as its own entity. We're going to look at whole community planning and what defines that, both in the population, but also in looking at different stakeholders and partners. We're going to look at the key principles of what inclusive emergency management means, looking at the different tactics and guidelines, and then also strategies for how to make sure that you're doing this properly, and looking at the specifics of why, how, and what, and making sure that you're reaching the whole community, including the different stakeholders. And I think we're going to go to a really poignant example that Amanda will share now.
Yes. So I started with FEMA as an adjunct instructor around 2014. And that was the time when a wonderful woman named Marcy Roth was the director of the Office on Disability Integration and Coordination. And the first time I met her in one of her courses, this is the story she told. And I think this story really gets at the heart of why inclusive emergency management is important. And it also gets at the heart of why I do what I do and why we emergency managers do what I do. So in 2005, Hurricane Katrina, was expected to be a terrible hurricane, but it wasn't expected to be as bad as it was. So in August of 2005, Hurricane Katrina, was in the process of just devastating Louisiana, especially New Orleans. And there was a lady named Benilda Caixeta who lived in the New Orleans Upper Ninth Ward. And Benilda saw the hurricane coming. She had done a lot of work around trying to prepare to be evacuated because, as you can see, or maybe if you can't see, Benilda had quadriplegia. And so she used a wheelchair in her daily life. She was extremely independent and was able to complete all the daily functions that she needed for her life. So as Hurricane Katrina made landfall and the devastating flooding began, the arrangements that she had made ahead of time were not following through. So she was stranded in her apartment or house, I believe it was an apartment, with no way out. She had shared that she was trapped and needed some assistance. So her name was passed on to Marcy Roth, again, the former director of the Office on Disability Integration and Coordination. And Marcy made contact with Benilda and used her resources and experience to try to get an evacuation for her. So due to the inundation of water in that area, she was not able to locate an evacuation source for her. Benilda submitted numerous requests to the local accessible transport system, but those requests were not fulfilled. And during a conversation, this went over a kind of a couple days between Benilda and Marcy speaking, trying to get her evacuated. But during one phone call that they were having, Benilda started panicking and she told Marcy that the water was rushing in to her home. And then the line cut off. And Marcy tried continually to get back in touch with her, but there was no luck. And about 5 days later, they found Benilda's body and her wheelchair floating in her home. And this is really why inclusive emergency management is so important. Nearly 25% of the population of the United States experiences either a disability or an access and functional need. And when you don't plan for that 25%, these are the stories that you hear. These are the lives that are lost. You know, one example I can give you is my last disaster with FEMA. I worked the Camp Fire in Northern California, the Paradise Fire that wiped out that entire community. And 84 people died. And of those 84 people, all 84 had some form of an access and functional need. And planning for their evacuation was not done ahead of time. And that contributed significantly to why they weren't able to evacuate and why they perished in the fire. So, you know, I like to tell these stories because it puts a human face on the tragedy that is experienced. And the good thing that came out of Hurricane Katrina was the law, the Post-Katrina Emergency Reform Act. And that really put in place a lot of laws that are required around inclusive emergency management planning. So why do we need to be inclusive? That's a really good question. Other than, you know, I told you this story, I hope it pulls on your heartstrings a little bit, but what are other reasons why we need to be inclusive? First, it's the right thing to do. We have a moral responsibility to plan for all of our citizens in our community, regardless of their national origin, their race, their sex, their gender, their disability. All of that, we have a moral responsibility to plan for everyone. So ensuring that all individuals in your community have equitable access to emergency preparedness, response, recovery, and mitigation, it's a cornerstone of good governance. It will prepare you and put you ahead of the game when it comes to time to respond. You know, during a disaster, everyone is at risk of harm. Nobody really gets out of a devastating disaster unscathed. But some individuals within an impacted disaster area will have these pre-existing life circumstances, and that can disproportionately increase the risk of exposure, and it can contribute to negative health outcomes during a disaster. And when I talk about life circumstances, I'm talking about things such as a lack of economic or cultural or social resources. And the lack of those resources can really hamper an individual's ability to identify or access support services. At the same time, it's important to recognize the ways in which communities are naturally resilient. Through experiences with daily hardships, how everyday resources, support networks, and institutional knowledge can serve as an invaluable asset to emergency response efforts. So emergency management is a field that really is moving beyond traditional definitions of accessibility planning. It's now emphasizing the need for more holistic and community-based approaches. And, you know, another reason to be inclusive is it strengthens your ability to prepare for, respond to, recover from, and mitigate all hazards. You know, and the whole community approach is a valuable efficiency and cost-saving tool. An example of that would be if you purchase items that will meet accessibility needs of individuals with access and functional needs ahead of time before a disaster, chances are you'll save a lot of money and time versus trying to purchase those items and logistically get them to where you need them to be during a disaster when demand is really high and really expensive. Also, and I hate including this one, but I have to, it's required by law. There are multiple laws that will require equal access and equitable access for people with access and functional needs. One of them is the Rehabilitation Act of 1973 that prohibits discrimination against people with disabilities by recipients of federal funding, which most emergency management programs within jurisdictions do receive some sort of federal funding. The Americans with Disabilities Act of 1990, again, that prohibits recipients from discriminating on the basis of disability. In the operation of, you know, transportation, places of accommodation, things like that. And again, I mentioned the Post-Katrina Emergency Management Reform Act of 2006. So this act, as well as the Stafford Act, mandates integration and equal opportunity for people with disabilities in general population emergency shelters. And there are many, many more laws, such as the Fair Housing Law and things of that nature that apply around inclusive emergency management. So next we're going to talk about what do we mean by access and functional needs. So who are included in that population? So first, we will have adults and children with physical, mobility, sensory, intellectual, developmental, cognitive, or mental health disabilities. We also include older adults because as it has been shown that as you age, your chances of developing a disability or an access and functional need increases. We also include people with chronic or temporary health conditions, pregnant women. Now, you wouldn't consider a pregnant woman to be someone with a disability, but they do have access and functional needs. You know, their daily life activities could be limited because of their pregnancy. We also include people needing bariatric or other medical equipment, people with limited English proficiency, low literacy, or additional communication needs, people with low income or who live in limited resource areas, people without transportation access, and people experiencing homelessness. So this is not an exhaustive list of who is included in the access and functional needs population. And chances are there will be another, chances are at some point in your life, you will develop an access and functional need. Let's say you get hurt and you break your leg. Well, that qualifies you as having an access or a functional need because you're not able to maintain and perform your daily functions as normal because you have that injury. So it's a really great list to think about. I know we have some questions on this that we will address going towards the end, but I want to turn it over to Lori to talk about behavioral and mental health needs during a disaster, because people with behavioral and mental health needs are included in the access and functional needs population.
Thanks, Amanda. And you touch upon a really interesting factor. So behavior and mental health needs can show up and be internalized both differently across all ages, and they often look different in different ages. So when you have a young child, how they express their anxiety or their stress, it may look different than a teenager as opposed to an adult or older age individual. And the reason why we include this is because, especially in disaster, someone with a pre-existing condition can have varying levels of anxiety. They might have compounded levels of trauma, and again, that might look different according to your age and or experiences. That also includes your different experiences of resiliency. So it's not all going to be a like a stress or anxiety induced thing. People also have developed resiliency over their lifetimes. But when we look at the access and functional needs in preparedness and response and recovery, it's also important to include mental health needs across all functions and across all sectors. So for example, looking at transportation, I was working in Florida, and after Hurricane Irma, and we were working in a very low resource area, mostly with migrant farmers, and they had very poor access to transportation, and most of their healthcare needs were in neighboring counties. The buses only ran, I think, once or twice a day, and people were not understanding, both at the state level and community needs, why their mental health needs were also increasing. And you know, this is just an example of how not looking at the entire picture and planning appropriately can also increase someone's stress level. So it's not just the disaster or emergency itself, but it's also looking at the whole pipeline of planning and making sure that things are both effective and sustainable. So we also look at, like I mentioned, the comorbidity with pre-existing or new conditions. There are some areas, as we know, that just get hit from disasters repeatedly. And again, while that can help people to develop resiliency, it also creates this sense of compounded trauma, especially if someone already has a pre-existing condition that may not be related to the disaster at all, but if someone has anxiety or attention issues or other related trauma or PTSD, that often increases the incidence of someone's anxiety and stress reactions to this disaster itself. And when you're planning for that, you want to make sure that you're doing a really robust needs assessment within your community and of the resources, which we'll talk about later, but to make sure that you're planning and resourcing and addressing the needs of your community and of your partners and stakeholders. Sometimes behavior and mental health needs show up differently in people. Not everyone has a diagnosis. Some people do, some people don't. It's really important to look at the person and or community as an individual and as its own entity, and not just rely on a diagnosis. It can show up cognitively. So like Amanda said, we are all impacted by disasters, whether you're working in the field or a community member or directly impacted. It can affect our thought process. And it's interesting because in COVID, there's a lot of research and information being put out there now about how being in quarantine for so long, being isolated for so long, and not, having to adapt your routines and schedule has also really impacted our thought patterns. And I'll give you a personal example. My mom called me the other day. She lives in New York. I'm on the West Coast, and it was midday on Sunday, and she called and said, this entire day I was going along as if it was Monday, and she was worried. And I had to really like help her anxiety and really explain to her that how our cognitive functioning is really impacted by a disaster. Also, it can show up physically in our bodies. A lot of times we hold stress in our bodies, which can duly impact someone who has a physical disability, or even if not, it often can create different, it can impact someone with chronic pain or other physical ailments. Sometimes people will complain or talk about stomach aches or headaches or just feeling more lethargic. And those are all signs that while you're planning, that you should pay attention to what people are saying and how they're feeling. It also can impact our emotional being. And I didn't write this here, but also our spiritual. People react in all different ways. And in planning, you want to make sure that you're taking care of spiritual needs and emotional needs also. In a lot of the shelters, they have mental health workers. I know FEMA has a crisis counseling program. And so I think that the disaster field has really done a good job and keeps improving of identifying and addressing and creating sustainable planning for people and their mental and behavioral health needs. The essentials of planning before an event is a key point. Often when a disaster happens, people are scrambling. Whether you're directly impacted or working in the field, people are really trying to get a sense and identify what are the immediate needs, what are the immediate needs for security and your food and safety and shelter. And those are not necessarily the best times to make these partnerships and to understand what your resources are. So the aspect of planning before a disaster and including the access and functional needs, including behavioral health needs, is really important. So you can have things in place and have a foundation as you move through the different phases, both in the immediate response and long-term recovery. We know that a lot of disasters take years to recover from. People are still recovering from Hurricane Sandy. People are still recovering in Puerto Rico from Maria, and all of the those partnerships and relationships that you can build beforehand are really important to nurture and to have in place, whether it's through mutual like MOUs or through different contracts or even just through ongoing relationship building. Those are things that can get lifted up and really help your communities heal. And that also includes how we're identifying and talking about individuals, which Amanda's going to talk about the language that we use and how that impacts.
So something that you may or may not be familiar with is person-first language. Now, this is something that, in my experience, the majority of the population of people with disabilities prefer and believe in person-first language. Now, you will find some people with a disability who really don't care or are indifferent to person-first language, but as a whole, we try to model and preach person-first language. And what that means is you focus on the person, not on their disability. So they're a person first, and their disability is something second. It describes what they have or what they experience, not who they are, what they are. Again, it's a characteristic. It does not define who they are. It's a characteristic just like, you have brown hair or green eyes. And it maintains dignity and respect for the individual who experiences a disability. So some examples of person-first language versus not person-first language. So a lot of time you hear people say she or he is disabled. Well, in person-first language, it's she or he has a disability. And you can define that disability, whether it's an intellectual, a cognitive, a physical, or a psychiatric disability. Another example would say that, you could say Robert is homeless. Well, a better way to say that was Robert experiences homelessness. Or, Emily is a quadriplegic. Well, no, Emily has quadriplegia. So again, it might seem like something small, but the quote here that I have by Mark Twain, it really does matter. It's really all about respect and putting the person first, because when you describe the person as something, it really forgets and takes away from the human element of an individual. And, when we're talking about inclusive emergency management, that really involves whole community planning. And I'm going to turn it back over to Lori to talk a little bit more in depth about what whole community planning is.
Thanks, Amanda. So I think a key factor in whole community planning is equitable access to both programs and resources, and that is without discrimination and without bias. I know currently, and in the last few years, there's been a big distinction, which I think has been a positive move to really identify the difference between equity and equality. And it's really important that when you're looking at planning, it's not just equal access to programs, but it's also equitable access to programs and resources. So what I mean by that is when we talk about equal, we think that something is the same, that people are offered the same. They're offered an equal opportunity. But when we're talking about equitable access, we look at where someone starts from. And we know in our society, people are not all starting from the same place. So some people are starting, they have less resources, as we talked about earlier, they have less income. Their school systems might not have as much resources. Their healthcare system might be struggling a little bit more. And so when we look at whole community planning, we want to make sure that resources, programs, policies, I'll even go far to say that they identify equitable access, that they look at where communities are starting from and how to ensure that those people and communities are going to be able to respond to and recover from a disaster or emergency. It's about fairness. We also want to make sure that we meet the needs of all individuals and not just some. That kind of makes sense, but it doesn't, I think years ago, we've come a long way from where we started years ago. We've learned a lot of how to actually identify and meet the needs. So not just in like resources or looking at like, are resources available, but you want to make sure that they're available in certain languages. You want to make sure that there's that physical access is being taken care of. I'll talk about that a little bit more later, but looking at like, what are your building structures? What do your restrooms look like? And more. We want to make sure that consistent and active engagement is throughout all aspects of planning. And so, like I said before, we don't just start when a disaster happens. We want to make sure that that starts beforehand and that continues through recovery. Partially because of the number of disasters and events, and I think just the nature of how things have developed, we tend to move, the media tends to move from one event to another really quickly. And it's really important that when you're looking at planning and through recovery, that when you're planning for recovery, that you want to make sure that things are consistent, that you're going to have resources to last throughout, and that you're engaging throughout, that you don't just move from, you know, a month or 2 months or even 6 months sometimes after an emergency and expect that things are going to fall on their own, because resources often take time, recovery takes time. It's more of a marathon once you get past the immediate response. And like Amanda said, we want to make sure that we include not only that we're describing individuals and communities appropriately, but we're including the voices of individuals and community members that might be experiencing needs. So someone who has some sort of physical handicap that is an issue, we want to make sure that those people are at the table in planning. No one knows experiences better than ourselves, and in order to really get a full picture of what needs are, a lot of emergency management agencies have taken to creating either task force or different coalitions to bring people from the community to the table and to really help understand how to robustly create a plan that is really spoken from and addressing the needs of community members themselves. And part of that is looking at the different principles and guidelines, which Amanda will now begin to talk about.
So when we talk about inclusive emergency management, there are between 10 and 11 key principles. Now, a lot of them are pretty well known, so you may know them. So please don't be kind of daunted by the fact that there are so many. So the first thing we have to think about is physical access. You know, people with disabilities and other access and functional needs should and are required to be able to enter and use emergency facilities across all programs, services, and activities that are provided by your organization. Facilities that are typically required to be accessible include parking areas, drop-off areas, entrances and exits of your building, security screening areas, bathrooms, any bathing facilities, sleeping areas, dining facilities, areas where medical care or human services are provided, and then also your paths of travel to and from and between these areas. So people with access and functional needs must be able to access locations where emergency programs and services are provided. So whether that is your Office of Emergency Management, or it is your an area where you provide resources during a disaster and after a disaster. So for example, with COVID, you know, we're doing all the testing that's happening. You need to make sure that your testing facilities are accessible. And then when we hopefully get a vaccine, you know, if you are responsible for dispensing that vaccine, you need to make sure that that location is accessible to everyone. And this, you know, really applies during all phases of emergency management. So preparedness, response, recovery, and mitigation. And it also applies not only to permanent barriers, but temporary barriers. I can't tell you how many times, you know, that I did within FEMA, we would do what we call a site review to make sure that the location and the facility that FEMA was using for a disaster was accessible. And the entire building could be completely accessible, 100% amazing, but then someone puts a trash can in the wrong place. And that trash can will cut into your path of travel and will make that location or that part of the location inaccessible. So it's keeping in mind it's not only the built part of your building, but also the temporary things that you put in place. Another thing to talk about is universal design. If you're not familiar with universal design, it is a concept and a building method to where you design your organization with the greatest accessibility from the get-go. Because when you think about certain things in our world that are universally accessible, such as when you go to a grocery store and they have automatic doors, those doors are not only put in for people who may have an access and functional need or maybe in a wheelchair and need to get inside. It's also for people pushing carts out full of food or mothers with babies in their stroller. So if you build your facility or your organization with that in mind of being accessible to everyone regardless of a disability, that concept will go so far in having to prevent you from having to do modifications in the future. Next, we'll talk about our programmatic access. So people with access and functional needs must also be able to access the same programs and services as the general population. So that may require that you do some sort of change or modification in your delivery of services. A great example of that would be allowing, if your office is kind of a no pet, no animal type of office where you have that rule in place, a modification you would make would be to allow someone with a service animal to be able to come in. Another way that you could make a change in your delivery of services is, you know, if you have a program that is only offered on site, you also could change that and modify it to where those services or that program is also offered over the phone or on the website so that people who cannot physically come into your office are still able to access those services. Another example is to have accessible signage throughout your building. And again, that also contributes to the idea of universal design because yes, accessible signage can most often has Braille included on it, but it also works for people who may have low vision or people who struggle with, you know, having to wear glasses. Making that signage a little bit bigger can help everyone. And next, we want to talk about effective communication. So effective communication is a really interesting topic. So people with access and functional needs must be able to obtain the same information provided to the general population. Communications with people with disabilities must be as effective as communication with others. Some examples you could put in place are auxiliary aids or services to ensure that communication is as effective. These resources could include, you know, a pen and paper, a certified or not a certified, but as American Sign Language interpreter or on-site video. Interpretation aids for people who are deaf or hard of hearing, or people who have cognitive disabilities may need some large print information, or people at your organization to assist them with reading and filling out forms. Another way to ensure that effective communication is in place, use of assistive technology, such as providing screen readers if someone is blind or has low vision, and offering all of your materials in multiple languages. So we're not just looking at people with disabilities, but those other access and functional needs in case you have someone who comes in that you know has low literacy or English is not their first language. So I'm going to turn it over to Lori to kind of talk about the next 3 key principles, which are also very important. Lori?
Yeah, thank you. So I was on mute. The next key principle is inclusion, which kind of embodies the other 3 that Amanda was talking about, but it's also considered its own because of the need to really emphasize that people who have access and functional needs have a human right to receive all of the benefits and participating in the planning of emergency programs, in their services that they receive, in all activities that happen throughout all of the phases. The different needs and the different differing types of abilities in planning, in training, in evaluation of programs, it's important to realize that we're including all different types of people. So, for example, the needs of someone in a faith-based community might be very different than someone in a school community. And so being able to specify those needs when you're looking at the different programs is really important. And like you see on the slide, it also includes the physical needs. So making sure that you have a ramp available. There are different standards for ADA accessible restrooms. There might be different needs for different religious or spiritual communities for kitchens. So according to what their dietary needs are. So making sure that when you're doing planning, you're looking at who, what the population is and who you're serving. Another key principle is integration and not separation. So when you're looking at the activities and services, they have to be provided in an integrated setting. We are, as much as possible, we are a community that is trying to move towards integration and the provision of services, such as sheltering, such as education services, looking at short, midterm, long-term housing. We're looking at this as a whole community and not in different pieces according to, we want to make sure that we're serving everyone regardless of your ethnicity, your income, regardless of your race. We're looking at how to make sure that when we're planning, we are covering our entire community. Some examples of this, or some exceptions to this, might be in shelters. There are people, there's some religions might require that are separate. So when the emergency management planners are looking at these different communities, being able to identify different structures that can function in that need is really important. Maybe, like I said, having different kitchens. Some people might need different sinks. So being able to do, and same with housing. Some people might not be able to, you might need different housing, like for trailers or those with ramps, different buildings. One of the important things that happened in New York in Hurricane Sandy, where people got stuck on top floors. And so when you're looking at how to provide housing, making sure that people will be able to go in and out of a building and have access is really important. Also looking at different program modifications. So not only is it about the physical structures, but how you're developing these programs. So how are you creating and designing and developing the programs, but then also how are we communicating that to impacted communities? So how are we asking questions? Who's asking the question is also really important. Are we people who understand the needs of a community? Are we using gatekeepers to different communities? It's really important to de-escalate like anxiety and stress. And so being able to really understand those needs and being able to communicate things appropriately and with the right language is really important, especially when you're talking with people who might have English as a second language or may not speak English. We want to make sure that that what you're communicating is also being understood. We might need to provide sign language interpreters. We might need to provide English language interpreters. We also, as Amanda said, being able to make adaptations for service animals, if that's important, if that's needed, looking at different education support, how when you're in a shelter after after a disaster, or even currently in COVID, right? We are experiencing really big shifts in education for youth. So let's say like we adaptations from in-person learning to virtual learning. And we've also found throughout the country that as part of that, not everyone had access to computers and or Wi-Fi. And so this is a really good lesson to learn for future planning and making sure that when things happen, we are able to provide support for all ages and all different needs. And I think we're going to move on to the next few principles that Amanda will describe.
So thanks for that, Lori. We're going to move a little bit quicker through the slides so we have plenty of time for questions. Something else that you need to think about is if there is a modification that needs to be made for a person with a disability or an access and functional need, by law, you cannot charge them for those changes. So an example is if someone is deaf or hard of hearing, they may need a sign language interpreter, you cannot charge them to hire that sign language interpreter. Another example, if you have someone who needs maybe a larger cot in a shelter or a lower cot, again, those costs have to be absorbed by the organization as that's required by law. Another thing to think about is self-determination. So people with access and functional needs are really the most knowledgeable about their own needs. So people without disabilities or access and functional needs, making decisions for them really takes away their self-determination. So go to the source. If you are unsure of what modification you can make, go to them and ask them because they are going to know, they know themselves best. Something else is no one size fits all, which Lori touched on previously. People with access and functional needs do not all require the same type of assistance and do not have all the same needs. Also, many different types of disabilities affect people in different ways. So preparation should be made for people with a variety of functional needs, including people who use mobility aids, people who require medication, use service animals, or people who need information in alternate formats, things of that nature. And also equal opportunity, equitable opportunities. So you want to make sure that people with access and functional needs have the same opportunities to benefit from your emergency programs, like I had mentioned before. And emergency recovery services and programs should be designed to provide equivalent choices for people with access and functional needs, as they do for people without access and functional needs. And again, equitable access. So we want to make sure that people with access and functional needs are able to access and benefit from all emergency services. And that applies in areas such as emergency preparedness, notification of emergencies, evacuation, transportation, communication, housing, and application for and distribution of benefits. Next slide. And so how do we make emergency management inclusive? So these are the strategies we want to talk about. So first, assess and train your workforce. You can map out your skills and capabilities within your own staff that can contribute to that. You want to educate your staff on health equity concepts and what that really means. You want to diversify your workforce to represent the communities that you're serving. So, including those stakeholders that have an access and functional need within kind of your workforce is really important. So you have that in-house knowledge. And also you can utilize exercises to identify gaps in your planning and build policy change. You also want to look at cultural shifts and varied approaches. So incorporating considerations for people with access and functional needs across the entire spectrum of emergency operations center positions will help. Also, assigning individuals and teams in the emergency operations center with the authority to lead access and functional needs planning. You can leverage existing capital. So if you have people in your emergency operations center or in your program that speak a different language or have access to community networks, you can capitalize on those resources. You really want to engage your stakeholder groups within your community. You want representatives from different types of access and functional needs areas on your planning team, because again, they're going to give you the knowledge that you may not have, because like we know, you don't know what you don't know. And also, it's really important to establish relationships and communication networks ahead of time so that those are in place and you can access them when disaster hits and things get really chaotic. Also, integration, that's another strategy. So you want to make sure that people with access and functional needs are included in your exercises and your planning. We want to make sure that your shelters are integrated. So for example, generally you have a general population shelter, and then you have a shelter that is for people who have a higher need for medical services. Something that often it doesn't happen is the recognition that just because a person has a disability or an access and functional needs does not mean they need to be in that shelter that requires that higher level of care. They may need some minor modification within the general population shelter to maintain their independence. So you don't want it to be a, oh, they have an access and functional need or disability, they have to go to the higher needs shelter. That's not how it works. And if you wonder about that or you don't know, go ahead and ask the person in the shelter, find out what their needs are so that you guys together can make that decision on which shelter would be best for them. Again, something else to think about is, dedicated incident command system positions. So, like an access and functional needs advisor. FEMA has disability integration advisors, and that was the role that I filled. So, or you could also have these advisors within each section. So an example would be having an advisor in external affairs to assist with scheduling American Sign Language interpreters, or within housing to assist with accessible housing and that nature. It's difficult to only have one advisor because that can be difficult to rely on, as bottlenecks may occur when it comes to making decisions around access and functional needs. So we're going to go into the next strategies of what we need to do to be inclusive, and I'm going to turn it over to Lori.
Thanks, Amanda. I'm going to run through these a little bit quicker than expected just because of time. So there's a few different elements that we need for to be inclusive. One, we've talked about a little bit, partnerships. So looking at what existing government agencies are in your area, different community organizations that you can leverage, and I would also say different state agencies. So partnerships already exist, and when you are missing a partnership, it's really important to find things in your community, as we said, before an event. One of a key aspect of planning is to conduct needs assessments or a needs analysis, and that is both of your communities that are being impacted and also of the agencies. So what, for example, what buildings might be available, what buildings can be transformed into a shelter fully or partially, what are the differing needs of your communities, including behavioral health needs. So what kind of strategies and programs and planning are we going to develop before an event that we can then leverage during an event? Also looking at different types of tools. So looking at response tools that also extend through recovery. What can be utilized in your emergency operations center that can then extend out into the community. Looking at different incident command structures, what functions can apply to different jobs needed. Looking at different action sheets, looking at also, there's an ADA standards for accessible designs. There's a big document. Amanda might be able to speak more to this, but there's also a condensed version for different agencies and for your emergency operations center to, as a guideline. It's a quick guideline that can be used both globally and also like for different smaller agencies. We also want knowledge to be inclusive. It's really important to not assume and not to make assumptions that we know who we're planning for, but we want to make sure that within your emergency operations center, within your partnerships, within the partnered agencies and different stakeholders, we understand who we're responding for, who we're responding to, and what assets do we have within our own agencies that we can then leverage within an event. This is really important to use throughout all of the phases, so it's not only effective, but that we build efficient structures and that it is also sustainable. And then a lot of have different events, we might need to have like kind of lift up different staff and community knowledge, as Amanda described before, and also we might need to do some role shifting. So understanding what other skills and what other assets does your staff have that might be outside of their designated role that we can then shift to. We're going to now turn to a structure, a framework that is used by FEMA and a lot of people in the emergency field that Amanda will describe.
So, but for the sake of time, I'm actually going to skip this slide, but I can include some notes in the slide so you can kind of understand what the CMIST framework is. Again, it's looking at, this is the framework that's used to make sure that you've included and integrated the needs of people with access and functional needs in your emergency planning. But we want to go ahead and go to the next slide, which are questions. I'm going to answer as many as I can. Any questions that I'm not able to answer or that we're not able to answer, we will answer in a Word document, and we'll attach that to the email with the slides and a link to the presentation. So one question is, why do you separate the terms people with disabilities and access and functional needs? Doesn't the access and functional needs definition include people with disabilities as one of the categories? That's a fantastic question. And yes, the phrase access and functional needs does include people with disabilities within that definition. The reason we separate them and the reason I separate them is because when you look at modifications you need to make, most of the modifications that you will find that you need to make are for people with disabilities. They generally represent the majority of modifications that need to be made, as well as the fact that people with disabilities are covered under the law, the Americans with Disabilities Act, whereas most people with access and functional needs may not qualify under any sort of law. So if you have an individual that has English as a second language, there is no federal law that really provides them protection against discrimination. Whereas if you have a person with a disability, there are several laws that provide them coverage in case there is discrimination. So that's why I tend to separate them. I don't do it all the time, but I think it's really important to understand that in terms of the law and coverage under those laws, they are kind of separate populations. Okay, the next question is, where is the access and functional needs definition taken from? That's a really good question, and I actually don't have a definitive answer for you on that, as that term access and functional needs has been around for years. It's a federally adopted term, so it's used within FEMA, within the Centers for Disease Control and Prevention. So that's a good question. I will do some follow-up and I will answer that question within that email that we'll send out. So we're right at time right now. We just wanted to go through a couple of the last slides real quick to kind of give you an idea of who we are. Nora, do you want to speak to it?
Sure. So many of you that are on the call today are healthcare providers that have to meet the CMS emergency preparedness compliance requirements. Yes, that is a mouthful, but we say it often because we do so much CMS work. But what we have is a CMS 2020 emergency preparedness compliance toolkit. And what that does is everything that you need to be compliant with developing your emergency plans, your training drills and exercises to meet all the requirements. And it's for all 17 provider types. So whether you're a dialysis or home health or hospice, hospital, skilled nursing, primary care, et cetera. We also updated a provider chart for all changes because there's significant changes that came out from the omnibus burden reduction. And we're also including our pandemic planning response guide. That's included. It's $150 value because we want to provide that. And then you get $700 and includes 4 hours of consulting. So there's the hot links there directly, and also we'll include those in the follow-up email.
All right, so again, thank you everybody for joining us today. We're so grateful you took the time to listen in. We will get the slide deck sent out. And you know, if you need help with planning for inclusive emergency management, that is something we can help you with. So we'll send out the slide deck, the answers to questions, and the link to where you can find the recording. And then also, we would love for you to answer a survey that we're going to send out. It's a brief survey. I think there's 5 or 6 questions that will really help us to improve our future webinars, as we offer these quite regularly. So please give us your feedback. Tell us what else you want to learn about. You know, and we incorporate that into our practice. So again, thank you so much for joining us, and we look forward to hearing your feedback.